These numbers are going to come into play later when we talk about stability of the knee. Here's what we see when we tear the ACL. Usually happens in a position of relative extension with rotation. Now, it doesn't have to be locked, but it isn't going to be bent more than about 45 degrees. So you'll see it usually about here, which if you think back to those videos that I showed you at the beginning, the knees were all about here. Okay? But they all involve some rotary force. Now, 70% of ACL injuries occur with no blunt force. The person's by themselves, running, doing something. You saw that with RG3 in the first video. He was by himself trying to scramble after a ball. That last one, however, when you saw Bowman, he was hit. About 30% are caused from actually being hit and struck in the knee. Player does that, he's going to hear a loud pop or snap. Oftentimes, the whole crowd will hear a pop or a snap. Often, it's loud. For some people, it's incredibly loud. You'll hear almost like a gunshot. Now, the swelling's going to take place in about 2 to 4 hours. You go to the doctor or you go to the hospital. First thing that they're going to do most of the time is draw some fluid off of that knee. Why? What are they looking for? Did you know that every ligament in the body has an artery that piggybacks it? Okay, the lateral geniculate artery piggybacks. Right there, that ACL. So what happens when you tear the ACL? You tear the artery. So when they're drawing that fluid, what are they looking for? Blood. Exactly. They'll still send you for an MRI, but that's their first indication. That's their first indication that, boop, yep, this person most likely has an ACL tear.